back to Medical Associates Health Check. It is Christmas season. I hope you're all getting ready, but we have an important topic to talk to you about. Around this time of year, we're all in the festive mood. We're eating, we're drinking. So we see a lot more acid reflux. And so we wanted to talk to you about it. We also see a lot of gallstones. So with me today, I have Dr. Sanju Solomon, our gastroenterologist. Thank you very much for coming back.
Thanks a lot for having me again.
Thank you. And I have Dr. Parvati Raghunath. She is our house officer on our ward team. So let's talk about acid reflux first.
Okay, so I know that everyone would have heard about acid reflux in some capacity. We probably covered it on this program before. But just as a quick refresher, acid reflux is that sensation, that heartburn sensation typically that patients have that is usually associated with meals. It happens after meals. And the typical symptoms that you get would be, again, you get this burning in the chest. And sometimes you feel like acid coming up into the mouth, and you could get a sour taste. Those are the typical symptoms. And you also have some atypical symptoms, or the more uncommon type symptoms that can be associated, such as some people have coughing, some people develop chest pain, shortness of breath. So those would be considered atypical.
Some people also complain of pain in their ears, burning in their throats.
Gas in the shoulder.
Yeah.
Yeah.
But it's common. I mean, around this time of year, I have to say, I see it more than any other. Mainly because our diet is pretty poor. I mean, we've just come out of Diwali when people eat a lot of fried food, and then Christmas is there and it's ham, jam, lamb, everything under the sun. So you have this typically more common than the other things during this period.
Agreed. There are periods of time where the diet does contribute, I think, and we see a lot more patients coming forward with, persistent symptoms. And really and truly, if you have symptoms for more than 3 days a week that you can't get under control with, routine things, and we'll call those lifestyle measures, that typically is where we call it gastroesophageal reflux disease, because a little bit of reflux is normal. But usually when you start getting these symptoms, patients try to, they identify what foods are triggering it.
Correct.
They try to eat on time, because the stomach actually works like a clock and makes acid in anticipation of meals. So the eating on time is important. If you're having a lot of symptoms at night, you can try to skip any meals within 1 to 2 hours before you go to bed. Raising the head of the bed also helps, because it makes it so that the acid has to work against gravity. Weight loss, because the belly pushes on the stomach sometimes, and also exercise helps tighten up the valves to prevent some reflux. So those are the typical lifestyle things. And when that doesn't work, patients usually resort to medications.
Yeah.
And the simplest things would be the antacids.
The Deca, the Pepto-Bismol is everybody's favorites, right?
Correct. Tums, Enos, and essentially that's basic chemistry.
Yeah.
Acid is really acids, hydrochloric acid. And those medications or the antacids are basic, meaning that an acid and a base neutralize each other.
Yep, correct.
Those tend to work quickly, and they can work with acid symptoms that you're having right now. But stronger than that would be the medications that actually block acid production. And that's where when you get into the omeprazole and the esomeprazole, the pantoprazole, those stronger class of medications that block acid, and those work well.
Yeah.
But what do you do when those medications don't work?
And I think that's the thing we're seeing now. We have a lot more people that say, I was on the course of medication, I don't know what's wrong, it's not working, and they're coming in because they're in a lot of pain. So we do run tests, and we'll have, Parvati has come on board because she's actually a patient for us, and she's willing to give us a little bit of her story. So actually, do you want to talk about your experience?
Of course. So like you were saying just now, it's especially for me, and we all know being doctors, it's very difficult to kind of keep that meal like per se in track. We can't eat on time because we have different things going on at different times. And I think this is a typical case of where the doctor becomes a patient now, and my acid reflux has just been uncontrollable. My symptoms had typical and atypical symptoms, like Dr. Solomon was mentioning, and it was just getting to a point where it was kind of a little bit overbearing. And I felt like, I needed something to be done. And I went to Dr. Solomon, and of course he recommended for me to get the Bravo pH testing, which I was very grateful for doing.
Before we go down there, you would have had a scope done, I'm
Yeah,
assuming.
Yeah.
So typically when the patients come to me with a similar story that as Parvati came with, we, again, just reinforce the lifestyle things, make sure they're taking the medication properly, and those proton pump inhibitor medications have to be taken within 30 to 60 minutes of a meal, before the meal, because it blocks production. Doesn't work so well if you take it after. And once they're following all of that, and they have so-called refractory symptoms that are uncontrolled with the basic things we're doing, then yes, we do consider whether we need to do an upper endoscopy. And the reason for doing that is really just to identify if there's any signs of anything else that might be causing these symptoms. Is there inflammation of the food pipe, ulceration, which is where the lining gets eroded, any signs of H. pylori bacterial infection?
I was just about to go there, yeah.
Any hiatal hernia, which is where the food pipe pulls the stomach into the chest a little bit, and that compromises that valve that keeps the acid into the stomach.
Yeah.
And sometimes, on rare occasions, it requires surgery to fix. So those are the reasons for doing an upper endoscopy. And then, provided we do the endoscopy and we've excluded anything more and sinister, then we can consider this Bravo pH testing, which Parvati was going to allude
Which
to
is
there.
this new technology that we're using. And it's really exciting because as far as I know, Medical Associates is the only institution in the country that holds it and runs it. So let's talk about that. Tell us about your experience.
So yeah, actually, it's such an honor to sit here talking about this because it's something I actually feel very passionate about. Of course, we have a gastroenterologist here who, is very, very skilled at what he does in every single thing. And going to Dr. Solomon and getting this actual recommendation to do the Bravo pH was, it was really, really beneficial in my opinion, right? So we had a consultation and without hesitation, I said yes to doing it. This was, I believe it was one of the first times that we actually tried to do it in the country. And like Dr. Solomon tends to joke about me being patient zero for the test.
Or the guinea pig, yeah.
Yeah, the guinea pig.
So just to give everybody an idea, the Bravo is a capsule, right?
Yes.
And the capsule is something that they put into the stomach through an endoscopy.
Yeah. And this is not new technology. I don't want people thinking that this is brand new, but it is the first time we've, decided to try to push the envelope and offer more diagnostic testing in Trinidad. So this would have been the first time we've done it in Trinidad.
In the country, yes.
And it's important because now it gives us more options in terms of really objectively classifying how much acid reflux someone is having. And as you were saying, what we do is at the time of endoscopy, we just go a little bit, about 5 to 6 centimeters above that valve that divides, that separates the stomach from the food pipe. And then we just attach this tiny little probe like the size of my fingernail with suction, so it's not anything permanent. And it just clips onto the side of the food pipe. And essentially what that does, acid reflux, for you to perceive that acid, it has to come from the stomach, pass this sensor probe, and then get into the food pipe where you get these symptoms. So it records the pH or the acidity level every time you have acid reflux. And what it allows you to do is you have this little recording device that you can press a button to record your symptoms. So it allows you to correlate the symptoms with your actual acidity levels. So you can be objective about whether the acid is really causing your symptoms or is it something else.
Exactly. Yeah.
Okay, that's interesting. But what we're going to do is we're going to cut to break. And when we come back, you'll get to tell us a little bit more about the experience itself.
Great.
Okay. Don't go anywhere. We'll be right back.
I was diagnosed with colon and liver cancer. Hearing the news, I was devastated. Having to go overseas, that could be stress and away from your family. Medical Associate, there was no other place to go, and I'm glad that I did because they made my journey even better. I'm more comfortable. They made me part of the family. So besides my immediate family, I now have another family here. I was asking about the cost, and she was like, don't worry, we could organize. So that was a burden taken off of my shoulder. It was like a personalized thing. It wasn't just like the cost, because I've heard that it's so expensive to do this, but they treat you as an individual. I would like to thank Dr. Raghunanan, the office manager here, the nurse in particular who is here with me during the chemo, and Dr. Bim. and also Dr. Solomon, because he was the one that did the colonoscopy, but they made me feel comfortable. I would recommend medical associates because number one, the care that you receive, they make you feel comfortable and being part of a family besides your family. Of course, it's not that matter. What matters is to get you better. So I'm glad that I have this option here, and many other people will also have this option here if it is that they just do their research. For everyone who is going through this, don't lose hope, keep the faith, and know that once you have a positive mindset, you can get through this. Together with the medical staff, together with your family, it can be done.
At Medical Associates Oncology Unit, we know every cancer journey is unique and deeply personal. That's why our team of expert oncologists, nurses, and specialists are here to provide you with world-class care right here in Trinidad and Tobago. From early diagnosis to advanced treatment options, we offer cutting-edge technology and compassionate support every step of the way. We're here to guide you emotionally, mentally, and we understand how costly treatment can be. So, we have reduced our prices to assist you financially as well. Every aspect of your journey matters to us. With expertise you trust and care, you can feel Medical Associates, the Caribbean's #1 comprehensive and internationally accredited hospital.
Welcome back. Just before the break, we were talking about new technology that we've brought in Trinidad. Although it's not new around the world, it does give us more options on diagnosing acid reflux. So we were just talking to Dr. Raghunath about her experience. So please tell us, how was it?
So essentially, it was the most seamless process ever. I was bracing myself for torture, but unfortunately, it wasn't like that. Unfortunately or fortunately. Unfortunately, because it was torture before with the acid reflux. I felt like my acid had a personal vendetta against me. So, so we started off just with the routine endoscopy procedure. It was very, very easy, light sedation for the procedure as well, too. Then they had the device inserted, and it was as easy as that. The procedure really took only about half an hour, really, if so much.
And how long was it inside for?
So it was in there for it was implanted, and then I had it in for a period of we were monitoring the device for a period of 3 days, but you can monitor it up to 96 hours, right? But we had just set it for that period of time. Mm-hmm. So it was so easy. You wake up, and you have no tubes on you, nothing coming out of your nose, nothing, no stairs going down the hallway. And I was able to do every single thing that I was normally able to do. Okay. I was able to go to the gym the day after. I was able to do a lot of my routine daily activities. The only qualm that I have about this is that it was this little transducer device that matched with none of my outfits. And that was the only problem. But I mean, for the most part, it was such a seamless process. Okay. I was able to record. So there's on the actual device itself, there's these 3 tiny buttons that you have to just press when you're getting your burning symptoms, your reflux symptoms, when you're getting heartburn, and during breaks. So they'll just record whenever it is that you're actually not actively using it. So we just had to, every time I got these symptoms, just press a button and it would record the time, and I would actively take a time diary of when these symptoms actually happened for over the past 3 days. And it was as seamless as that. And, and afterwards, the only disadvantage of really having it was that, yes, shortly after you're just tiny, we're aware of this tiny little speck, maybe feels like a little rice grain on your esophagus, but it goes away very, very, very quickly. And and of course, if you're planning to have your routine weekly MRI, then that will be an issue. But
sure,
of course, MRIs are not deep.
So why, Dr. Solomon, is this important for the population of Trinidad and Tobago?
So the utility, this is not for everyone, first of all. This is a adjunctive or additional tool that we now have to diagnose acid reflux. Mm-hmm. And I would say this is more pertinent to people who have had a normal endoscopy, have had long-standing acid reflux symptoms and tried every treatment under the sun, and they really haven't gotten resolution. They actually been driven crazy enough to think about doing surgery or something. But what you really want, you want to confirm that the symptoms are related to acid. Yeah. So this is useful, I think, before you consider some acid reflux surgery to really confirm. It's also useful in patients who have those atypical symptoms, and those are the patients who have been using acid medication for years, and they're having symptoms like coughing or chest pain, or some of them have shortness of breath, and we get referrals from the asthma doctors, from the chest pain or the cardiologist doctors, ENT doctors for these types of patients. And we really just want to be sure that this is acid before we continue giving them this strong acid medication. So I think it gives us the opportunity to potentially stop some patients from taking acid medication in perpetuity, because as we know, all medications have side effects, and you should be using the lowest dose for as short a period of time as possible to get your symptoms under control.
Okay.
Yeah. If it's one thing that I'd like to interject as well, to a really big benefit to me especially, was that you could objectively measure the acid reflux while you do your daily activities. Because while you're in the hospital and you're lying down on a bed, and trying to get testing and stuff, all of those things done within a hospital setting, it's way different than actually, going in your house and maybe sneaking out doubles here and there, and you actually have that objective measurement of the levels of acid that you produce, which is in itself such an added benefit.
Okay, great. So all in all, it's something you'd recommend?
Oh, 100%.
Okay.
Yeah.
Well, thank you very much for coming today. We really appreciate
Not a problem. I thank you all for having me.
Yeah. Don't go anywhere. We'll be right back. And when we come back from break, we'll be talking about gallstones, jaundice, and how we manage it. We'll see you on the other side.
AI technology is changing healthcare. And at Medical Associates, our new AI-powered MRI scans give you clearer images in half the time. And right now, you can get $800 off your MRI at our St. Joseph branch. So call us now to book at 662-2766, extensions 4072 or 4073. At Medical Associates, we make it easier to get the clarity you need with the care you deserve.
Our CT scan services are quick, comfortable, and designed to detect internal issues early, often before you feel a single symptom. Because the best way to treat something is to catch it early, and Medical Associates makes that easy.
Just call 662-2766, extension 4072.
You're in expert care at the Caribbean's #1 comprehensive and internationally accredited hospital. Don't wait for signs. Take control of your health with ease and confidence at Medical Associates, where care always comes first.
Welcome back. We were talking about acid reflux before the break, and we have our dietitian here with us now, Miss Dana Chung. Thank you for coming.
Thank you for having me.
So we want to talk to you about the Christmas diet, because we do have lots of diseases such as acid reflux, but also we see gallstones and jaundice around this time of year. So we want to have a little discussion about it and have Dr. Solomon give us his input as well. So tell us about what you see as a dietitian and the particular season that we're associating with right now.
Okay, so we are approaching the Christmas season. What we tend to see a lot of with the foods available during Christmas is that they are high in fat. Besides being high in fat, they tend to be high in meat consumption. So that would be turkey, ham. Some people eat other types of pork, minced beef, minced chicken, and all these. If eaten in large amounts, they are high in saturated fats.
Right.
Yeah. So, of course, a high-fat diet is one of the contributing factors to developing gallstones. Yes?
And I know I see more of it in A&E. I don't know about you. Do you see more of it this time of year?
Well, I do see it, but obviously is when they're referred to me from the A&E or another doctor in a specific sequence where we know exactly what the stone is doing.
Yeah. So it's more of a fat-related stone than
I would say so, absolutely. And I mean, it's well established that you need bile, which is produced by the liver.
Correct.
To digest fat. And then when that fat from that Christmas diet we're talking about here hits the stomach, it sends a signal to the gallbladder saying, look, fat's coming down the road. Let's release some of this bile to digest that fat. And then what happens is when you have that concentrated bile crystallizing in the gallbladder, forming those stones, when it squeezes to release the bile, it shoots the stone as well. and it could either block the gallbladder, it could block the bile duct, and that's where those patients end up in the emergency department with abdominal pain and jaundice.
And it tends to be, on Boxing Day, when everybody comes in, it's always Boxing night for some reason, and everyone comes in, they're like, I'm in severe amount of pain, and it's in the upper abdomen. So it always, I have to say, it's a preconceived notion that it's going to be gallstones. Before we touch diagnosis and how to manage it, can we talk about how we prevent it?
Most certainly. So in preventing gallstones, studies have shown that including monounsaturated fats, which are basically the healthy fats, over unhealthy fats are what can help to prevent gallstones. And when I say monounsaturated fats, that would basically be including small amounts of healthy fats from nuts, from fish oils, from plant oils, specifically olive oil and canola, for example. And this would be in place of using the saturated fats that we just mentioned, which would be fats from animal foods, fatty animal foods, and high-fat dairy, such as full cream, milk, ice cream, things like that.
So overall, how does someone enjoy their Christmas?
You can still enjoy your Christmas. It's very easy. You just have to replace some of these high-fat options with leaner options. So for example, if you are having ground meat in your pastel, you just look for the ones that are lean ground beef versus the one that says prime ground beef, which tends to have more fat in it. Even for your beverages, when you're having panchagram, when you're making a panchagram, typically people use full cream milk.
Okay.
Instead, we can use skimmed milk, and then we could also use non-fat yogurt to thicken the panchagram instead of using full cream milk and full fat evaporated milk. Okay. Yeah, so those are ways to lower fat content in Christmas foods.
That's useful. So on the back of that, there are going to be people that are willing to take the risk and run with the consequences. So we are looking at a patient that comes in on, let's say, Boxing Day, just before Christmas. Alcohol content is high, food is at its best options available, and you have somebody that comes in with jaundice. How are we treating this patient? What are we thinking about with this patient?
All right, so with respect to jaundice, there's a large number of conditions that could contribute to jaundice, and jaundice is, just to define it for those that don't know, that is essentially when the bilirubin level in the blood goes up. And then those are the people that you have yellow skin, yellow eyes, and then the usual sort of algorithm is that Trinidadians go to the pundit and try to jarry.
Right.
But
right.
You really should go see a doctor if you start noticing
get yellowing of your skin.
Your loved ones are turning yellow. So you come in if you have jaundice and abdominal pain and that specific sort of scenario you just outlined. We do some blood tests to see exactly what the pattern of jaundice is because, as I said, you have different causes of jaundice. It could be a liver problem. But specifically what we're talking about today would be if there's a obstruction of the bile ducts or so-called obstructive jaundice. And that really is picked up on some form of imaging. Usually an ultrasound is the best way to determine if there's a stone or something blocking the bile duct, because a lot of stones could possibly be missed on X-ray or CT scan. So the ultrasound is able to pick that up, and better than that would be an MRI. So if you have that patient who has the symptoms, the lab tests are showing some form of obstructive jaundice, and the imaging is showing gallstones, then we have to figure out what to do with that.
Okay. So what's our next step?
So it depends on where the stone is.
If it's blocking the bile duct or if it's blocking...
So if that stone really has exited the gallbladder and now in the bile duct, that is a tricky problem. Ordinarily, if the stones are just in the gallbladder, patient just needs a cholecystectomy, which is removal of the gallbladder.
And we've touched on that in the past.
Right, but specifically now, if the stone is in the bile duct, then usually the world over, the next move is something called an ERCP.
Correct.
So that is a non-surgical procedure, is an endoscopic procedure that requires a special side viewing scope that is done under general anesthesia and requires the use of the X-ray machine. And essentially, it's an endoscopic procedure. We go down the food pipe, the stomach, the first part of the small intestine, and we look at a tiny little pinhole where bile comes out into the intestine, and we try to fish a little wire into there. And once we get in, we make a tiny cut from the inside, and then we are able to use the X-ray machine and contrast to see the stone.
Yeah.
And then we can use a variety of instruments, balloons, and baskets to remove the stone. After which, we have cleared the bile duct and the immediate problem is resolved. They still have to consider getting the gallbladder removed because that was the original factory for the stones.
And that's the original problem, so you have to
Yes.
look at that. Now, what happens if a stone is not radiodense, i.e. it can't be picked up on the X-ray?
So we'll still pick it up on the ERCP
Okay.
because the ERCP looks at putting contrast in, and wherever the stone is, it shows up as a tiny little circle. So we can still pick it up, and if the CT scan or X-ray doesn't show it, sometimes we can see it on an MRI.
Yeah. So how often do you do this procedure?
So we do it pretty often because unfortunately there's not a lot of persons that do this procedure in the country. So a lot of it is funneled towards the one or two providers that do it. And it is quite common, and it can be very problematic for those patients because they tend to get recurrent bouts of pain. It can be life-threatening, especially if there's an infection in the bile duct around the stone. So it is considered a semi-emergent procedure.
But what's the risk of the procedure?
So the risks of doing a ERSP would be, with most endoscopic procedures, there's a risk of infection, bleeding, putting a hole through the side of something that you wasn't planning to put a hole through. Specifically with ERCP, there's a risk of pancreatitis,
Right.
because the bile duct and the pancreas are very close together. But incidentally, leaving a stone in the bile duct also increases
Causes
the risk of
risk of- yeah.
pancreatitis.
Yeah.
And of course, there's the risks for the anesthesia. The anesthesia risks are relevant as well.
Yeah.
But it is an essential procedure in that scenario. And there are circumstances where we don't get the stone out, in which case they may need surgery.
Right.
But so one would ask, I typically get asked, why don't we just do surgery and take out everything? And the reason for that is because the surgery to remove a stone from the bile duct is a lot more involved, and it carries increased risks.
Surgically.
Because you have to cut the bile duct, remove the stone, and then stitch the bile duct up. So there's a risk of leaking. It can heal tight. So the world over, the sequence is ERCP, take out the stone, and then proceed to take out the gallbladder.
Okay. We hope that you've gotten a lot of information today, and we hope you stay safe this Christmas season. And if you're interested in booking an appointment with our dietitian, feel free to contact us on 662-2766, extension 4061. And if you'd like to speak to Dr. Solomon's team, feel free to contact us on the same number on extension 4019. Alternatively, come through switchboard and somebody will transfer you. We hope to see you again next year. Have a wonderful Christmas and a happy new year.